In this video, I'm going to chat about the 3 most common things I surgically remove from a cat's digestive tract with the goal of giving you the best chance to keep your cat off of a surgical table. And at the end of this video, I'm going to chat about the most unusual thing I've removed from a cat's stomach, which I still cannot believe. I'm Dr. Osk, cat veterinarian since 2004. We begin with small toys, and this brings me back to a case early in my career, back when I was a young, green, inexperienced veterinarian. The case was pretty straightforward, at least initially. Cat comes in, vomiting, can't keep anything down. We take a radiograph or an x-ray of its abdomen, and it has a classic presentation for a full obstruction. So I took that cat to surgery. In the beginning of the intestines was the obstruction, and it turned out to be half of a mouse toy. Everything else looked normal. The stomach and the rest of the intestines were all completely normal. They felt normal, so I confidently closed all of my incisions, monitored that cat, and discharged that cat a few days later, who was already eating and playing in their cage. Case closed, I was done, so I thought. Now that I'm an old, experienced veterinarian, that's not necessarily the approach I would take today. And the main reason is because it's too easy and straightforward, which can happen, but oftentimes doesn't, because this is life, this is medicine. And you've probably guessed why I'm telling this story. That cat came back a couple days later for the same symptoms that it presented initially, vomiting. And I knew the second half of that mouse toy was in that cat somewhere, so I didn't hesitate, I didn't think twice. I took that cat right to surgery, and I found the second half of that mouse toy in the normal looking, normal feeling stomach after a very large stomach incision all the way at the bottom of the stomach where the esophagus enters the stomach. Now, for those of you that may be thinking, well, duh, it's not quite that simple, for a couple of reasons. The first, I've taken many half-eaten objects out of a cat's digestive tract only for the client to find the other half somewhere in the household. So it's not necessarily a guarantee the other half of the toy is in the cat somewhere. The second issue is positioning. Cats lie on their back during the surgery. The stomach is tucked under the rib cage, and it takes a little patience, a little finesse to kind of get that stomach out to reveal itself. Now, where the intestine connects to the stomach, that's pretty easy, it's right there. But where the esophagus attached to the stomach, that's much further down, much harder to access. And I'm dealing with gravity, which pulls things away from me towards the surgical table. And that's what happened in this case. The other half of that mouse toy was sitting all the way at the bottom of that stomach, right where the esophagus opens, making it very difficult to see and feel. The only way to know that it's there is to make an incision in the stomach. One could say that the word experience is just a fancy term for the collection of one's mistakes. And since I am a experienced veterinarian, after that cat, if I'm doing an abdominal exploratory looking for something in a cat's digestive tract, I'm making an incision in the stomach, looking around and feeling around. And you would be amazed at how many things you can find in a cat's stomach that aren't necessarily causing an issue, even when the obvious problem is in the intestine. So when I say small toys, that may seem a bit obvious, and you should definitely keep them away from your cat. And if you are going to allow your cat to play with them, do so under strict supervision. But this also applies to larger toys that can be chewed and broken down, because those smaller toy pieces can act like small toys and also get stuck in your cat's digestive tract. What is a trichobezoar? That's medical speak for a hairball, or a collection of undigested hair, typically in the stomach, but they can move into the intestines to cause a full or partial obstruction. Not as common as one might think. At least in my experience, I am rarely removing hairballs from a cat's digestive tract. And when I do, I ask 2 questions. Is a cat ingesting more hair, like with fleas or some other skin issue, or maybe the time of year, like with spring or fall when a cat is shedding more and turning over their coat? Or why can't a cat pass the hair they normally ingest? More on that in a little bit. String or linear foreign body is the second most common thing I am surgically removing from a cat's digestive tract. And this includes yarn, tinsel, ribbon, and dental floss. I am typically doing these surgeries around the holidays, think Easter and Christmas, when people have decorations out and gifts are lying around. Dental floss is the exception, which can happen any time of the year. And the big reason is that trash can in your bathroom that doesn't have a lid or the lid doesn't latch, allowing your cat to have access to these death strings. And I say that because dental floss can pretty easily cut through a cat's intestine, which is why this is so serious. The reason why linear foreign bodies are so serious is that they usually are attached somewhere in the digestive tract. And since intestines are intestines, they try to digest them, which results in intestinal bunching, also known as the according effect. The easiest way to understand this is to think of my sleeve as the intestines. If there is an attached string in the digestive tract, the intestines continue to try to digest them, which results in bunching of the intestines, and that string can cut through the intestinal wall, which may result in an infection in the belly. There is no telling where a linear foreign body will attach itself in the digestive tract. And underneath, in the back of the tongue, is a common location. This area can be very challenging to evaluate in an awake cat, and we are often doing so in an anesthetized patient that is being prepped for surgery. My craziest case, I had a string that extended from the back of the tongue all the way to a cat's colon. If you want to see what that looks like, take a second look of the picture of me in surgery at the beginning of this video. When a string is attached inside of the digestive tract and the intestines are bunched, potentially that could result in a long surgery, and one might have to make many small incisions within the digestive tract to safely relieve the intestinal bunching and remove the entire string. The most enterotomies, or incisions in the intestine, I had to make to remove one string from one cat was 11. That's 11 incisions in the intestine and one in the stomach to safely remove one string from one cat. And before I could close that cat and wake them up, I had to run the bowel, looking for any leaks or any abnormalities that the string might have caused now that the intestines were not bunched. What is pica? I'm not a big fan of this term because, in my experience, it is overused and doesn't answer the question why a cat is compulsively chewing, sucking, or eating non-food items like fabric, plastic, cardboard, or paper. Yes, cats can do it out of boredom or when stressed, and there may even be a genetic predisposition. I'm looking at you, Siamese. More often, again in my experience, there is an underlying medical issue. And this transitions nicely into the third most common thing I am surgically removing from a cat's digestive tract: hair ties. Again, this brings me back to when I was a young, green, inexperienced veterinarian. I remember this case like it was yesterday. I was in my first year of practicing, and I saw a cat with the presenting complaint of swallowing hard. The owner had seen this behavior many times and was concerned. Since I was a new grad, I was in the habit of looking ahead a day or two at my schedule to see what types of appointments I would be seeing, so I could do a little research beforehand. I really didn't find too much on cats swallowing hard. But in these situations, you go back to your training. You take a thorough history, you perform a thorough physical exam, and based on the information and findings from your exam, you create a plan. History, pretty normal, minus the occasional hard swallowing. My physical exam findings, completely normal. My plan, give me a call if this continues. I had nothing. I had a relatively healthy young cat that would occasionally swallow hard, and a concerned cat parent. A few weeks went by, and I looked at my schedule ahead of time as I normally would have done, and I saw that this cat was coming back in to see me. The only reason I remembered this cat is because I had no idea what was going on. And I knew exactly how this was going to turn out. It was going to be the same history. Everything was normal except the cat occasionally swallowing hard. The physical exam was going to be the same, and my plan was going to be continue to monitor. But this visit, I offered blood and urine test, not looking for anything in particular, but just hoping to find anything, something that would explain this cat's symptoms. And as you probably can imagine, all lab tests were normal. So I had nothing. All I could say was, give me a call back if this behavior continues. And she did. A couple weeks later, for the same swallowing issue. I was freaking out. But you go back and trust in your training. A thorough history, a thorough physical exam. And this time, I found something. A large, firm mass in the front of its belly. And all I could think of was, what is going on? This makes no sense. Before I continue, I really have to hand it to this client for trusting me. Now, this was over 20 years ago. And I know that if this happened today, I keep thinking that if I didn't give her an answer on that first appointment, I would have never seen this client again. We live in a day where everyone wants answers and fixes yesterday. But I tell this story for a couple of reasons. And one of those reasons is sometimes to figure out what's going on with your cat, it is a journey. It does take multiple office visits. It does take multiple diagnostic tests. And that's okay as long as the cat is healthy, which it was in this case. The other reason why I tell this story is with this case and with many others, I've learned that cat parents are generally right. The hard part for us veterinary professionals is proving them right or giving them a reason for the symptoms they are seeing at home. And sometimes that just takes time. I still didn't know what was going on, but I had an exam finding and I decided to go right to the source and do a surgery. It was pretty easy to find this large, firm mass in the belly, which turned out to be the cat's stomach. And once I made the incision into the stomach, it became very apparent what was going on. Over the next 15-20 minutes, I removed 20 hair ties from this cat's stomach. And during that time, it all made sense. I could connect all the dots. What the client was noticing at home was her cat trying to choke down and swallow these hair ties. She never saw a hair tie, just the cat swallowing hard at home. And it took months for this cat to swallow enough hair ties to fill up the stomach, so much so that I could feel it. Remember, the stomach is tucked a little bit under that rib cage before I could ultimately make a diagnosis. Fun fact, for me, I've never removed less than 20 hair ties from a cat's stomach. It's always 20 or more. For some reason, 20 is a magical number for me to make a diagnosis and ultimately a surgery to remove hair ties. Yes, I have removed hair ties that have been mixed with other things, but alone, I need 20 hair ties to make a diagnosis. I remember the client's response after surgery, which threw me for a huge curveball. So I'm on cloud 9. I finally have a diagnosis. I have a fix. I am so excited to tell this client, who is understandably pretty frustrated at this point. So after surgery, I get on the phone. I tell her everything. I took 20 hair ties out of your cat's stomach. And her response, without missing a beat, are they the good hair ties or the cheap ones? Not the response I was expecting. Completely took the wind out of my sails. And I had no idea what she was talking about. I didn't grow up with daughters. I've had this hair my entire life. But I had a hospital full of women. So I just asked, hey, are these the good hair ties or the cheap ones? It was unanimous, the good hair ties. I'm still a bit confused, not really sure what is going on. I later found out she wanted to know which hair ties they were, so she knew which daughter to blame for leaving out hair ties that the cat eventually ate. So this was my big first abdominal exploratory, and I don't know where this came from, but I made this a rule and a requirement. If I take something out of your cat's digestive tract, I put it in a clear plastic bag, I double bag it, and you have to put it on your refrigerator for a week after the surgery, so that everyone in the household can see what I took out of their cat, and we can make sure your cat does not have access to it again, so they do not end up on my surgical table for a second time. Yes, this does happen. There are some repeat offenders. Fortunately, this is rare. I've removed so many things from a cat's digestive tract, not just toys, strings, and hair ties, but these are by far the most common things I am surgically removing. I also removed milk caps, milk rings, buttons, earplugs, and plastic pieces. Not as many fun things as you would find in a dog, but enough to keep me entertained and surprised. But the one thing that truly shocked me, which may not be too surprising for any of you that may own a dog, but it's completely mind-blowing to me and any cat-only parents, the craziest thing that I've surgically removed from a cat's stomach is a rock. So many questions. Why? How? So this rock, which was a pretty decent size, mind you, was in this cat's mouth. It's hard. It can't taste good. This cat went against its normal instincts, which would have been to just open its mouth and let the rock fall out. Instead, this cat continued with forcefully swallowing this hard rock, which can't feel good, let alone how it would feel going down the esophagus and then bouncing around down there in its stomach. This is beyond my comprehension. Having said all of this, these are the lessons I have learned over the years after doing these types of surgeries. Number one, never close up a cat before making an incision in the stomach and at least having a look and feel around. Number two, there is no such thing as a truly cat-proof house. Where there's a will, there's a way. And if a cat wants to get into something or eat something, like a rock, they're gonna do so. There is no predicting what your cat may get into or what it might find in a cat's digestive tract. And number three, if your cat is eating non-food items, look for an underlying medical issue. As an older, experienced veterinarian, it's not enough to remove a foreign object from a cat's digestive tract. It's not enough to say your cat has pica. I want to know why. And in my world, that typically involves a biopsy of normal-looking intestine at the same time as an abdominal exploratory surgery, so this doesn't happen again. And more often than not, we find mild underlying disease, like inflammatory bowel disease or IBS, which allows us to set up a conservative treatment plan, like a diet change, and monitor for progression of the disease later in life. This is especially true in my experience with hairballs. Why can't the hair a cat normally ingests pass through the digestive tract? Why did the hairball get stuck in the intestines? A biopsy of the digestive tract may be able to answer that question. That's it for Meow. If you learned something, make sure to like, subscribe, and comment. For more cat information, check out my YouTube channel, Cat Chat with Dr. Osk. Link is in the description. Thank you so much for watching, and I will see you on my next video.